I'm very pleased to hear it. So, RemindMe Care. I'm very glad to be here. The last time we were up in this part of the world was with the YAHSN as part of the Vanguard launch, and we weren't accepted then. So we've come a long way since then, so we're very glad to be back. RemindMe Care basically addresses problems that we're all well aware of: maintaining care in the community, stress, isolation, improving well-being, and the need for self-care management within the community. But at the same time, it also addresses the needs of formal care homes, daycare centers, memory clinics, and hospitals. So it seeks to be a lot of things to a lot of people. How do we do this? Well, we have a set of tools that are based around a concept that activities are the best way to engage the person. If you can't engage the person, if you can't engage the families, real care is never really going to happen. And whatever app you build, it's just never going to get used. You've got to get it used, and you'll do that through activities. And the activities we offer are reminiscence sessions, pretty much like what you've just heard, except we go the next step. We have personal content. You define yourself through life story with simple words, press a button, the system goes to the internet, sources across 25 billion images, content that match the person. So it produces a multimedia profile of the person in images, and that makes person-centered care much easier to deliver. We have CST, cognitive stimulation therapy, that's digitally delivered. I'm getting breathless. Come on. And we also realize that it's well and good producing a system that improves person-centered care delivery, but you've got to provide tools for the service provider. So we wrap business solutions, such as CQC reporting for the business sectors around that. And of course, one of the keys is connectivity, whether it's connecting the family remotely, connecting the local authority, connecting the care home to the hospital. Connectivity is key to using person-centered care data effectively. So how do we do all of this? Well, it's portable. Remy's portable. And Remy's what it's called these days. So when you're being cared for at home, you're just on a journey. So you may be cared for at home for a while with these different entities using the system, the local authority, the memory clinic. But at some point, you're going to have a dom carer come into your life. So you have a care tool that enhances person-centered care, which is free to the person using it, to the families, but each of the care stakeholders pays a subscription to be able to access that knowledge. So that overcomes the data transferability issue, because the data is owned by the individual and by the family. So here you can see Jane on her care journey. Now she's in assisted living, and that care sector can now access the knowledge of Jane to improve person-centered care delivery through activities. And the same with the hospital. We're working now with a number of hospitals in the London Trust, Southwest London Trust, and we have developed a RemindMe Care so that the person at admission the nurse can press a button and read exactly what was engaging the person the day before. So if a potential patient is agitated upon admission, the nurse can immediately know exactly what it is that will calm them. And during the stay in the hospital, they can deliver the same suite of activities that is being delivered in the care home or in the daycare center. So there's continuity of activity, which obviously is reassuring for the person with dementia. So it's a tool that serves the need of the family, of the person being cared for, and the various care stakeholders that they encounter along that journey. So to summarize, there's a set of tools for the person being cared for in the community, including a community builder that helps them engage with their local community, the mission being that they use the community more than they do the GP and A&E as a resort, and of course connectivity with the family. But for care businesses, there's a set of tools that, as I say, supports them in their business needs, and in fact including client acquisition tools for care homes. I guess the key to this is we've been building this for a long time now and working with key stakeholders like care homes and hospitals and some Nightingale Hammerson, the largest dementia care home in London. And we've been through a lot of iterations, there's no doubt about it, and we have engaged with all stakeholders, including the persons with dementia. And I think the most difficult group to engage was actually the professional carers, the carers themselves, who often thought what they wanted was right, but actually we had to find out that what they wanted wasn't actually usable. It's a very complex thing, designing for the different users. And just to round it off, we have had many different parties involved. We have such as Mandy Thorne, who's the Vice Chair of the National Care Association, working with us and helping us get it right. Lindsay Royham was one of the founders of and thank you.